Welcome, everyone. There might be a few people streaming in. We've realized we've caught you on your lunch breaks. So first of all, thank you very much for coming. I am going to get Rod to come and stand with me because this is something that is a collaborative initiative. So first of all, welcome. I'm going to do some housekeeping. So for those of you who haven't been here before, in the unlikely event of an emergency, you exit through the rear door and you meet north of McDonald's. How many people have been here and didn't know that? Right. Okay. Washrooms out the door where Callie is, to the left and right. And you've got an agenda before you. So first of all, I'd like to start off by acknowledging that we are on the traditional territory of the Tla'amin people, and we have many different agencies with us today. So this is a very exciting start. And I'm going to ask, Rod, we have put in the application jointly, but this is something that Mayor Ron Wasno will tell you about, has some history that goes back before my time with the city of Powell River. And then I will introduce our speakers after the mayor does his welcome to you. The mayor can't stay the whole time, so what we'll do is he will do an introduction, and then we will share some food, and then we will have Christy Wood from Nanaimo and Ali Bajwa present to us, and there'll be ample time for questions from all of you. So with that, Rod, I don't know if you've got anything else to say now that I've made him stand up. That's right.
I just want to focus on what you be presented. It's truly a community project. It's not RCMP initiated. We're just supporting the city and hopefully bring a successful situation table to town. We will certainly do whatever we need to do on our end, but yeah, it's a community project. So hopefully you're all raring to think about being a chair.
That's right, and a partner. And it's so early days. We haven't even picked a name for this, and so you're right here at the beginning with us. So with that, if I could turn over to your worship, Mayor Ron Wasno. Thank you.
Thank you very much, Lisa, and get out of the light there. Thank you very much. Would like to acknowledge that we're very appreciative of the grant that we received from the provincial government. My interest in this goes back about 7 years ago, where I helped bring back the community response network to Powell River. And I know we have somebody here who knows a lot about that activity. And for those of you who don't know, the Community Response Network's objective is to mitigate and hopefully eliminate adult abuse. And very important. I've also spent a lot of time at the senior center. And so again, I've seen a variety of needs that seniors have. And I don't like the stories about the phone calls where a neighbor is basically living in his car because his nephew and girlfriend moved in, and suddenly they made it so uncomfortable for him that he's in the car, and who in the community can help out. And I'm sure you all have lots of different examples where you get asked and it's not immediately obvious which community organization can assist. And so I think this initiative is excellent. It will make people feel more comfortable that if they see a need, that they have one person or one contact that they can get to, and that should really facilitate that. So with that, I just, again, to Lisa and to all of you, whatever the city can do to support you moving forward, we certainly will. So thank you very much. And I'm going to run so you can enjoy lunch. So, thanks, Lisa.
Thank you. I actually didn't mention who I was. I made this huge assumption. Okay, so I've been here about 7 months. I am the CEO for the city of Powell River. So my name is Lisa Bhopalsingh. You may call me Lisa B. That is perfectly fine. And one thing I thought I'd mention is the idea of a situation table for the city of Powell River. And by the way, I came from the city of Nanaimo, where Christy Wood actually worked with Ali Bajwa and team to set up a year and a half ago the first situation table for the city of Nanaimo. So lots of really important lessons learned, including feedback that was given to our funders that made it way easier when Rod and I put in an application. So thank you, Ali, for paying attention and listening. So one of the things I thought I'd let you know is back in September of 2023, one of the first meetings I had at UBCM with members of council was a meeting they had set up with Minister Farnworth. And my first week with council was actually in Vancouver, not in Powell River, meeting and working with my new council or bosses for the first time. And Minister Farnworth, your council was advocating for more supports for Powell River to support people with all kinds of complex care needs and who were falling into situations where emergency services were needlessly interacting with them. And as a result of that, Minister Farnworth in that meeting said, you know what if we offered you support and funding for a situation table? And, and so that's how my introduction to this came about. And in terms of putting in an application that was well supported by Ali and his team. So with that, I'm going to turn over to Ali Bajwa, who is going to run through some slides. And this is going to be an interactive session. And one last thing I'm going to say is several of you in this room for years have been collaborating to help community. And so I want to acknowledge that and acknowledge that some of your existing collaboration, as you learn what this is about, is saying, where does that fit? What is different about a situation table versus the homelessness task force, other collaborative tables around mental health and substance use? So think with that in mind. Where there's overlap, where there's synergies as we go forward to see how this fits. So with that, over to Ali. Thank you.
Thank you, Lisa. Good afternoon, good morning, good afternoon, everyone. My name is Ali Bajwa. I'm a program manager with the Ministry of Public Safety and Solicitor General. I oversee situation tables in BC. We have 44 situation tables that we have funded and 36 active ones. The purpose and the goal of my presentation today is, thank you. The purpose and goal of my presentation today, and I also sometimes speak really fast. So if I'm going too fast, please interrupt and stop me. I've been doing this a lot, so I have it verbatim. So the purpose of my presentation today essentially is to speak about situation tables, where they are, who they serve, how they operate, what's the distinctive part about them, speak about some of the data analytics that we have that are pretty cool, and how the province supports the municipalities through the process of implementing and running a situation table. But before I begin, I'd like to acknowledge that I am coming here today from the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh people, and I'm very happy to be here. I'm just a visitor. But happy to meet and excited about having so many folks from different agencies, sectors in a single room. That's the best part about a situation table, having that collaborative piece. With that said, I'm going to begin my presentation. This picture is from a symposium that we had, bringing together reps from situation tables across BC. You'll see Christy there with her eyes closed in the corner. I didn't even notice this. She just mentioned that.
Yeah.
Perfect. So the agenda. So introduction we've done. I'll give you a quick overview again, who, where, how, and who to serve, data collection, and the provincial supports. And then we'll have ample time for question and answers. There's going to be a lot of questions and concerns, and I'm happy to address all of them. Just a little bit about my team specifically. So I'm part of the Collaborative Public Safety Programs team. We oversee situation tables. We also oversee intervention circles, which is a pilot initiative that we have just implemented. It is essentially a First Nation-led and based situation table. Our first partner community is the Isketam First Nation, the Alkali Lake Band near Williams Lake. We also oversee something that we've done very recently is community safety and well-being planning in partnership with communities. We also have, as part of a team, Shift BC. Shift BC is a distinct part of a team that deals with counter-radicalization and anti-hate crime initiatives, and we provide free training to partners that are interested in that sort of training. So if you're interested, at the end of the presentation, I'd be happy to connect you to my partners at Shift BC. Perfect. Perfect. No worries. And I'm going to start with what is a situation table? What are situation tables? So essentially, the crux of the situation table is this. Situation tables are comprised of frontline workers from various agencies and sectors. This is not a case management initiative. This is more of a triage model. Partners come together to share information, limited personal information about individuals at risk. They meet weekly or bi-weekly, depending on community needs. As I mentioned, share limited personal information and go into a bit of a detail of how that works. The goal of the model, the goal of the meetings is to coordinate and implement an intervention within 24 to 48 hours. The folks that we are serving, we define them as people with acutely elevated risk. And that needs an immediate response. That's why we have the 24 and 48-hour intervention. This model is privacy compliant, has been reviewed by the Privacy Commissioner, and I'll speak a bit more about consent and non-consent and how that works and how that process looks like in the next few slides. Next is who participates in a situation table. Again, a really key slide. I know it's very noisy. There's a lot of information. So I'll give you a quick and brief overview. We have what we call core participants that we feel, based on our experience, are primary key partners. You have mental health and addictions, the police of jurisdiction, school district education, indigenous and culturally specific services, victim services, STPR, income assistant, health authority representation, and child and family services. On average, across British Columbia, the 36 active tables, we have 18 agencies that are represented. The common agencies across the board in all tables are police, mental health addictions, education, child and family services, and community-based organizations and income assistant. So basically, a lot of public agencies with the mandate to support people are all part of the table. We also have what we call local contributing organizations, ad hoc participants. So if an organization that isn't involved in service delivery directly, but might be seeing cases of individuals at risk, let's take an example of a library. Librarians can be part of the filter 4. They aren't the ones that are actively working or bringing cases, but they can actually bring forward a case through one of the chair, through a reps, because they do see a lot of people at risk that potentially might need supports and interventions. And I'll be happy to share the PowerPoint, so I wouldn't worry too much about this, but this is our list of situation tables and intervention circles, and you'll see Powell River at the far right column, tables under implementation. One of the things we do like to highlight is we have a very diverse distribution in terms of population size on what the table supports. So we have large communities. Obviously, Surrey has 2 situation tables, and we have very small communities like Smithers, Cornell, and Prince Rupert that also have a situation table. Who do situation tables serve? This is, again, a very key slide, and it somewhat differentiates the model from other collaborative models that are more case management. Situation tables serve people living with acutely elevated risk. Acutely elevated risk, or AER for short, is different from chronic risk factors. So entrenched homelessness, for example, is a chronic risk factor. Potential eviction is a acutely elevated risk, for a very simplistic definition. We define AER based on 4 metrics: significant community interest at stake, probability of harm occurring, significant intensity of harm, and the multi-agency nature of risk. So the first key factor is that multi-agency nature of risk. If an organization brings forward a case of an individual with one risk factor, let's say the person has financial hardships, but they are otherwise fine, they have no mental health challenges, they don't have any substance abuse, misuse issues, that wouldn't necessitate a multi-agency response and wouldn't clear the threshold of AER. So this is sort of the lens through which all the participating agencies determine AER for every discussion, every individual that is brought forward to a situation table. On to information sharing. Another key part, a major concern. So the filter for process this is consistent across Canada. The 4-filter process, it's tables operate in Ontario, in Saskatchewan. This is a model, and I should have started with this. brought to Canada in early 2000 from Scotland, and it was implemented in Ontario and Saskatchewan and brought to BC. Since 2016, we have had tables in British Columbia. In 2018, this became a mandate letter commitment for the minister and is now part of the Safer Communities Action Plan. So this is a government priority to implement and expand the situation tables. The situation tables sort of follow this 4-filter process through which they can share information for a client. Filter 1 is the internal agency review and referral. So does this situation require a multi-agency response? So let's say if a health authority is bringing, or like RCMP officer is bringing forward a case, they would first determine whether there's a multi-agency nature of risk. And to be frank, majority of the discussions in the cases, folks have on average 6 to 7 risk factors. So it's pretty common, and we'll speak a bit more about that in the next few steps. At filter 2, de-identified information is shared to determine if this, based on the 4-filter, the significant probability of harm, significant intensity of harm, significant community interest, to determine whether this meets the threshold in which you can then share limited information. And that is decided by consensus on the table by the partners. We follow a general consensus model. So what that means is out of the 10 partners, 6 of the partners have to agree that this meets the threshold where of acutely elevated risk. And now you can share limited identified information. At filter 3, what happens at filter 3, all the agencies will quickly go through the database, search the name of the individual and whether they have provided that person supports and services, whether they have a case file on that individual, and they can say, hey, I know John Doe, I work with him, right now we have him in a lockup, or we know where he is. Based on that, the table decides collectively, based on the individual's risk factors, based on which agencies have worked with them before, which agencies may have a relationship with John Doe, they determine which agencies will lead the intervention, which agency will be providing the support in that intervention. So that happens at the end of filter 3. Filter 4 is where these agencies that have been identified as the leads meet. This filter 4 happens off the table. It's basically 4 agencies or 5 agencies that have been identified to work together, come together, share personal information about the client, and see how best they can support them within the next 24 to 48 hours. That essentially is the structure of a situation table meeting. Christy has a few good examples she'll speak to, which might ground this sort of theory. Now to the good part. I love talking about our data because this is something that sets us apart from all other initiatives. We have systemic data collection and have been doing this data collection since 2018. We have amazing data from the last 5 years. We can see community trends. We can see community profiles. And I'm just going to give you a few highlights. So since 2015 to 2023, we have had around 3,000 discussions at situation tables. About 70% of those have led to successful interventions leading to a decrease in risk. What that essentially means is out of the 3,000 discussions, we have been able to connect 70% of the people to appropriate supports, and their risk has, as a result, gone down. Sorry, I think it was. I just want to speak a bit where this data comes from. So the way the situation tables operate, part of the process is they have an Excel file, which is stored on a provincial SharePoint site called a risk tracking database. This database tracks de-identified information about discussions. So we'll track age range, we'll track risk factors, we'll track a lead agency, responding agency, reason for closure. We don't track any name. There's no identifying information tracked in that database. And based on that, we're able to develop a profile. And all this process, again, has been reviewed by the Privacy Commissioner. We have documentation to support that. All the participating agencies sign on to a common integrated program agreement that allows them to share this information and allows us to analyze this data for the communities. So quick highlight, last year alone, we had a significant jump because we had a lot more tables coming online, 843 discussions, 70% overall risk lowered. But the best statistic, that one we are very proud of, and the one sort of explains the rationale of why public safety is leading the implementation of the table. One of the criticisms when we talk to small municipalities, when we talk to large municipalities, our stakeholders, is we get the first thing we hear from community services is cops are responding to calls that they beyond their mandate, and perhaps on calls that they've not been provided the most effective training on. We need to address this concern because policing partners have a very high caseload. one of the things we want to do through a table is to essentially alleviate that burden, identify appropriate services and supports that are better suited to the individual's needs, so we can take that response away from police into a non-policing realm. And the focus is prevention. And we have very good data to back this up since 2015. But in total in 2023, 25% of the discussions out of 843 were brought forward by the RCMP and the police of jurisdiction. So that's over 200 discussions. 80% of these discussions were transferred away from the police of jurisdiction. So we have either identified health authority, school district, or income assistance to be the appropriate lead as a result of situation table discussion. So that serves two purposes. One, it alleviates sort of the caseload that our policing partners have. Two, it actually allows to develop a more culturally support and safe intervention that might be better suited to the client based on the needs. And that's what we count as our success from a public safety perspective. Just giving you a quick overview of the 2023 risk factors. And you might not be able to read this at the back, so I'll say it out loud. Number one is a lack of appropriate housing. Number two is an inability to meet basic needs. And number three is drug abuse and misuse. Number four is suspected mental health concerns. Number five is financial hardship. And we track this year by year, and we can see what's happening across BC, what changes are being made. So lack of appropriate housing used to be actually number three. We had substance misuse and mental health concerns as the primary risk factors until COVID happened. And then we saw a significant jump in lack of appropriate housing. Just want to be clear one thing about this graph. It does not mean that so an individual with a lack of appropriate housing might also have the other risk factors. So it's multiple risk factors per discussion. And as you see, average number of risk factors involved per discussion is 8. So that speaks to the complexity of the challenges our individuals are suffering and what our participants and service providers have to deal with when developing an intervention or a plan. And that's why we need sort of this collaborative approach to identify a better solution. Top 3 originating agencies and top 3 lead agencies. So originating agencies are the ones that are bringing cases forward for discussion. Number 1 is the police of jurisdiction, 26%. Number 2 is the health authority, 9%. And number 3 is the school district. And you'll see the difference in the lead agencies where the police of jurisdiction go down from 26 to 10%, essentially means health authority has been identified as the lead in a majority of those cases. Police of jurisdiction is still number 2. That's why they are a key partner, because there are situations and discussions where there's a public safety concern or risk, either to the service provider or either to the client that needs to be addressed. Number 3 is Ministry of Child and Family Development. So this could be MCFT is a very complex organization. Child, youth mental health, youth probation could be any of those. And as you'll see, an average number of agencies involved per discussion is 6. So that's 6 agencies talking to each other, sharing information about a client and developing an intervention. And that speaks, this is a number that has gone up over the year. And that speaks to the success of sort of the collaboration that's happening at the tables. Before I get into provincial supports, I'll talk a bit about what we do with the data. So the data is connected. Every year, the province provides the analysis. So we have analytical capabilities in-house. We'll do the analysis for the province, for the municipalities. We'll develop community profiles, and we'll develop a provincial profile, and we'll share that with the partner. What the municipalities can do is then leverage that data to have conversations either with BC Housing, speak to the council, speak to the mayor, use the province's own data and the municipality data to speak to the province and the feds about, hey, these are the challenges we're seeing. So one of the things we needed to address with our situation table model, which sort of is sort of different from ICAT and some of the other collaborative models that are more focused on one particular issue. Situation tables are a very broad initiative. We track over 105 risk factors as opposed to one particular issue. But one of the things we wanted to focus on was to identify systemic gaps and challenges and to report that up. So a lot of initiatives work with clients directly, and that's where the conversation ends. For a situation table, it's very important that we do these provincial profiles, figure out what's actually happening in different districts, different regions, so we can then work with our internal executive leadership to focus and prioritize our supports. Speaking of those supports, so what do we do? What does the province do? So we do community outreach and engagement, which is basically something like this. We support training through our grant. We also provide admin support. So once a table's up and running, once you go through your training, you all sign on to a common and integrated program activity, and all the public bodies do a privacy impact assessment. We'll help you through the process. If there's any concerns and challenges, we'll address those challenges working with you. We also provide and manage a community of practice, which is something that I really love because we can leverage that to build a knowledge base. So every end of the month, every last Thursday, we bring together situation table leads from across British Columbia to have a conversation about what are they seeing in the communities, what is the challenge with their tables, are they seeing any issues they'd like to leverage other more experienced tables with, are there any documentation is there any documentation that could be shared among partners? So we sort of enable that collaboration. One of the cool things that comes out of it, for example, is one of the tables reached out to us and said, hey, I have a client here in the Lower Mainland who I know has basically left and gone to another community. This person needs supports. Is there anybody we can talk to? And I said, perfect. Let's talk to the Abbotsford Situation Table chair. So we were able to connect the leads from the two chairs, and they were able to transfer information and make sure that person was fine, was connected to services at the very least. We also have this risk tracking database analysis that I spoke about. All of this information, all your documents, all your agency lists, all their data is stored on a provincial SharePoint site, the process which was approved by the Privacy Commissioner. So we control access the table. So you'll have your own page within which you'll have your data, your documents, your memberships. You'll have limited access to it. Nobody else can access that. We have the Common Integrated Program Agreement, and we also provide free training, as I mentioned, from a branch partners on sort of counter-radicalization and youth radicalization. So if there's interest, happy to set that up. And I think with that, I'm going to stop here for a few seconds if there's any questions before I pass it on to Christy. Yes. So the Common and Integrated Program Agreement, and thank you for that question. The Common and Integrated Program Agreement essentially deals specifically with information sharing at the table. So what we have on the agreement is the membership list, who leads the table, and how that information is shared. So what we want to do, this is a requirement under the FOIPA legislation, is to have an agreement where there's information sharing happening between different public agencies. So the agreement doesn't speak to the funding, doesn't speak to supports. It's a voluntary agreement. Essentially, if your community organization has capacity and they're interested, they sign on to the agreement, they can participate in the situation table discussions. And what the way the agreement is structured, it essentially says, hey, this is what happens, the four-filter process, everything is laid out. This is how information is shared. You have your own public agencies would be familiar. Each and every agency is governed by their own legislation. So the agreement is pretty clear. Your legislation applies. If it's compliant with your legislation, these are the authorities under which, under the FOIPA legislation, within which you can share information. So working with the Privacy Commissioner and a lot of lawyers and the privacy folks, the four-filter process is privacy compliant and is compliant of the FOIPA legislation that allows us to share information about clients at risk without their informed prior consent. So you seek consent at the door knock intervention. Obviously, some people will refuse services. That's perfectly fine. We have about 10% refusal rate of services. But the key part is being able to share that information without having explicit consent of the client. And a lot of times that's necessary because you can't locate a young client who might be on the streets, might not have a fixed address. So it's really important to get that intervention plan and support and then figure out how best to support that individual. It's across all age ranges, ranges.
Bill, the mental health and substance use services has intensive case management, but continues to have these multiple occurrences with the criminal justice system and needs housing.
Absolutely.
Is that someone we would bring to the situation table because we have limited resources, finite resources, and that's quite often where we find we need more support.
That's a really good question. That gets to our discussion about chronic risk versus acutely elevated risk. So there's individuals within a community with chronic risk factors, right? They're entrenched in the justice system. They might have, if you're getting like 35, 40 calls about an individual, the police is getting calls, that means that person has chronic risk. But that doesn't mean that person isn't eligible to come to a table. The way this model is structured is it's almost about figuring out what's the best time to have an intervention, because that person might be more recipient, more accepting of an intervention. So if a person, let's say, has entrenched mental health issues, substance abuse issues, but they have one particular acutely elevated risk scenario situation, let's say they have financial hardships, and if you can address that financial hardship, like let's say you can give them like a community integration specialist can get them income assistance quickly so they can pay their rent, so it doesn't get worse. So they don't essentially, in addition to having mental health and substance abuse issues, become homeless, because that further it creates a further challenge. And now you have an individual that's entrenched, homeless, has mental health issues, has substance abuse issues, whereas we could have prevented things from getting worse had we intervened at the right time. And that's what the situation table is. It's a prevention mechanism preventing those things from escalating, preventing risk factors from escalating. I won't stand here and say this is a solution to a lot of capacity concerns and challenges. Each and every community in BC is struggling with, shelter spaces, homelessness across the board, substance and mental health challenges. That's something that we hear from all the partners. And frankly, this table isn't the solution to it. But what this table is positioned to do is prevent things from getting worse, but also support people at the right time. So if you can get a few people out of those situations, if you're intervening at the right time, that's what we see as success. It's to ensure that our partners that have very stretched, limited capacity, just by participating in these 1-hour meetings, are able to address some of those caseload concerns and work collaboratively. Go ahead, sir. Absolutely. So 2 very good questions. I'll take the first one in terms of success. So the way the province defines success of a table is it operating successfully, having a large number of discussions. I do have the analysis. I don't think, sorry. Oh yeah, actually, also.
I have lots.
So
That's just at a local level,
yeah,
not at a provincial level.
So that would be perfect, because I can speak provincially as a success, the data collection, seeing the interagency collaboration, but that's like actual success at the table. I think Christy is better positioned to speak to it, and I'll let her speak to that. But in terms of your other question, which I have now forgotten. Absolutely. So we do. This is something that does come up somewhat. So the province, this being a mandate-led commitment from the minister, is very well positioned to support and encourage participation from public agencies into the model. So, for example, certain tables reach out to us and say, "Hey, we don't have MCF participation. We want youth probation on a table. They're a key partner. We have a lot of youth at risk. We can leverage our internal connections to have a conversation with MCFT. With MCF, because we have a lot of youth tables being set up and a lot of youth at risk in the Lower Mainland, we scheduled a briefing with the Deputy Minister to get them on board, to make sure there's direction from the top that this is a priority initiative for that community. And that's the support that my office has the ability to play. It comes, and the RCMP is very supportive here, but in other communities where the RCMP might not see this model as somewhat of a priority initiative, my boss is the Director of Police Services, so we have engagement with E-Division. We have those conversations with senior leadership to make sure that the RCMP is part of it. And frankly, RCMP has been part of the model, police of jurisdiction across BC. They're champions of the model, and we have seen a lot of success with their participation. So hopefully that. Yes. I'll send it to Lisa, and
at the end, we'll you get with Christine now and every other.
Perfect.
Did you ever see duplication of services? communities? Like, I'd be interested to hear more about the data that's been gathered in other communities, just to see, like, with the mental health and substance use services that we have in Powell River, do you find anywhere that maybe it's a bit of overkill and really all the person needs is housing? Or do you see anything like that? Because that would be my concern, is duplication of service. When we've got a team working with a client in the community and then taking it to the situation table, would we take it to the situation table only if there was sort of one piece missing that we needed support with their care plan, or would be, yeah.
That's a very good question.
Figure out that.
This is a very good question from a health authority perspective, because this is something we get a lot. And there's few issues with it, a few things that I would like to talk about. One is that culture of collaboration, and like each and every agency is entrenched in their way of service provision, how they work with the client, what they think works best based on their successes. What a situation table does is allow to have that outside perspective, outside understanding. Let's say if you have a nation represent Indigenous nation or a First Nation community that's part of a table, they might have a different perspective about the client that some agents and representatives might not be familiar with. And that's what we'd like to do, is open that sort of conversation, have a different approach, sort of the traditional way of doing things, sort of address those sort of the shortcomings of that approach. But in terms of duplication and overlap, one of the things we have seen, and you can see in the data in sort of the risk factors, health authorities have a really good understanding of a client's health needs, right? They like, and Christy has some really good examples on this, but they might be missing a piece just based on, let's say, calls for service from the police. So they might not be aware or familiar. And I think Christy has a really good example for this. So I'll actually let Christy speak to this.
There's specific criteria that makes somebody elevated.
Yes.
It's being homeless isn't elevated, but there must be some kind of criteria that says we all need to come together.
Absolutely. So the criteria through which we define AER is, so there has to be significant probability of intensity of harm and recent. So, if you don't intervene, let's say if you have a client who has a lot of chronic risk factors, but they have one risk factor that might, so for example, let's say, and this is an example that I've seen, so an individual lives in a community, they have a few risk factors, substance abuse, misuse, but then probation comes along and they're like, hey, somebody's released from prison, they put them in a community, they like just release them in a community without connecting them to any services. This person had a prior relationship, maybe there's an element of domestic violence. So you need to intervene, offer this person supports to have that individual safe. So they might have chronic risk factors, but that's the acutely elevated risk where it's significant probability of harm. So likely to happen. And then the intensity of harm. Okay, this is something where we need to intervene. So a lot of the individuals that we have, and frankly, all of us here, everybody has risk factors. We have risk, but we are in a situation where we can operate. And we just want to make sure that people living with those risk factors, if they have one acutely elevated risk factor, we can address that. Potentially, we put them on a pathway where they can support themselves better.
I think too, yeah. I think sometimes we try to look at what's normal for that person, even though they might be living in chronic elevated risk. So some of the examples that we've had, of course, we could have so many referrals of people who are homeless, who have this chronic, this elevated risk factor because they need housing. But of course, we don't have enough housing, right? And so, but we still get referrals from people who are homeless who, we had one lady who was pregnant. She identified that she was pregnant and she wasn't connected to health services. So that definitely made it a referral. Or another person who was about to had a major infection in their leg and needed to be connected to health services. So of course that's above kind of that what's normal for them, right? And so that was a referral that was made. But we have many people who experience homelessness that we just can't bring them all to the table just because they need housing.
Have you found an increase in emergency department visits in towns where there is a situation? Data that's been gathered.
So getting health data is very, very complicated and
I'd
tricky.
be interested to know. I mean, if there's more eyes on people in the community, it would make sense to me that more people would be brought to the hospital. Yeah.
That's actually a very good. I'm going to make a note of it. Absolutely, really good question. So I'll give you a few examples of municipalities like Smithers, Campbell River. On average, have 60 to 65. Smithers had 80 discussions. Depends on a few things. Depends on the collaboration, the trust between the partners, and that's built over time. Initially, when you like Comox Valley has a table that we set up, had over 6 months had 30 discussions. So that's sort of the expectation around which you'll see. And a lot of times there are ebbs and flows. So you'll have periods where there's a lot of discussions coming forward, periods where you don't have a lot of discussions. The one last thing I'd like to say is speak about the role of the chair. I know there's going to be a lot of conversation about situation table chair and who needs to be a chair and what the role is. So the key to a success of a situation table is the situation table chair. The Nanaimo table is successful because Christy plays an amazing role, keeps everybody together, keeps everybody in check, everybody in line, but has that trust and builds that trust. So situational participants are exclusively people that work on the front line, deal directly with clients, or are able to direct people who work directly with clients. So it wouldn't be middle management. This isn't a planning table. This is, get to work. Let's help these people. That's the goal of a table. The chair coordinates these discussions. He makes sure everybody follows the privacy protocols, make sure there's participation. If there's a lack of participation, they can work with the province, they can work with the municipality and the leadership group to get people involved. That role has to be somebody with a lot of trust within the community, non-partisan, and somebody who has a good understanding of what the challenges are. So that's something that I'd just like to leave you with before I bring Christy to speak about.
I was
Perfect. I'm just going to transfer the slides.
Perfect. Great. Thanks so much, Ali. So my name's Christy Wood, and I'm the manager of social planning with the city of Nanaimo. And yeah, as Ali mentioned, I kind of started working with the province last year in 2023, and actually before that, and we can answer questions about training and that sort of stuff. And I think just like probably the city of Powell River, we're all facing a number of crises when we're looking at public safety, we're looking at health, we're looking at housing. And of course, as Ali mentioned, this table is not going to give you housing. It's not going to give you, all this loads of money. But what I did find that works really well is it's getting us to think outside the box. It's a different way of doing business. It's a different way of, here's a card. I want you to call this person to get connected to counseling. No, you're working together to offer those support services together. And so we all come together. You guys know how hard this work is. One of the things that you won't expect from participating on the table is just the support that you guys give each other, because it is hard work and the table's there. So yes, we're doing this hard work, but on the side, we're actually supporting each other and having understanding about how hard this work is. So I just want to state that. So we call ourselves the Nanaimo Acute Response Table. So we have just over probably 23 agencies that are at the table, and I'll kind of go over that a little bit later. We actually have two chairs. So I actually co-chair the table with a criminology professor from Vancouver Island University, which is great. We both don't obviously provide client-based services, which is kind of nice in our situation because we can really facilitate the meeting and allow the frontline professionals to actually do the work and kind of roll that out. You'll know that as you kind of go through the training process that there is a report back session, and the report back to the table once a referral is made allows us to actually see what support services are happening. It allows us, if there's gaps, to be able to support agencies. There's a little bit of accountability, which is kind of nice, and we all work together to kind of make sure that those services are offered as well. And then Ali didn't mention this. He'd mentioned the data part, but we actually have a role where we have somebody that does the data recording for us to measure those risk factors. And so we actually have a city staff person, but yeah, he's our community policing coordinator. I don't know if you guys have community policing staffing here, but they help with that and help keep on track of that as well. So I just thought I'd maybe give you an overview, and then I'm going to go into some of the successes and challenges. And then I think you guys might find that really interesting just from a kind of on the ground perspective. So this is the data that Ali was talking about with the risk tracking base. I always think like Smithers, they had 60 referrals. I was like, oh, we just had 28, but You know, Kelowna in 2022, I think, had 22 referrals. And I think you guys were talking about, and Lisa was also talking about, you guys are already doing collaborative work. And so you're going to figure out what that situation table works and how it works for you. We have a lot of different collaborative tables in Nanaimo. And so we don't want to duplicate services because, you know, we meet every 2 weeks. You guys probably have a ton of meetings. We don't want to add extra meetings. So it's looking about where that best fits with you. And so really making sure that if work is happening outside and people are getting connected to services, they don't need to come to the situation table. It's really for the most complex, where you're really struggling and they have multiple risk factors and where you can come together. So yeah, we've had, as you can see, compared to the province, our number one last year was around drugs and substance use, of course. Mental health was our second one, and then housing and alcohol and criminal involvement. What was interesting too is you'll see up top there, overall risk lowered. So we had 15 people that were connected to services. And then 7 where we are still AER. So that's that chronic risk. So if somebody needs housing and we don't have it, we keep them on the file. This is really important. When we first started, and I'll tell you about the challenges of actually getting referrals to the table. I went to a day of dialogue with the province and other situation tables, and we had the executive director at the time of mental health and addictions talk about complex care, but how they're looking at the risk tracking database. Right? So it's really important that you're getting referrals to the table where they need to be, because not only will the province be looking at it, but you guys can use that information for grants, applications. You can show that your community is collaborating with this risk tracking data. So it's really important for that too. And then it actually gives you, you know, your most common age groups, you know, females, males. What's really interesting for us, and you can build this within your risk tracking database, is if there's particular study flags that you want to look at. So in Nanaimo, we have an issue with human trafficking. So that was something that we wanted to capture. It's not a risk tracking, captured in the actual risk tracking database, but the province allows for different study flags that you may want to collect that might be a local issue. One of the issues in Nanaimo, another example, is that we have many of our homeless people who actually have CLBC dollars that aren't connected to services. So we're like, wow, this is like a new thing we're seeing. We keep hearing this, so we want to keep track of this. Our local nation wanted to make sure that we were tracking any referrals that were Indigenous. We also track opioid use, and I think the other one is youth aging out of foster care, because that seemed to be a really big trend that we were facing. So this is some of the data that you'll be able to capture, but this is just, so we started at the end of January last year. So this was just kind of how we were able to start. And this year, I think we are up to probably about half that amount, but I'm going to explain a little bit about the successes and the relationships that I've built. Because of the situation table, a lot of the work happens off the table, which maybe is a good and a bad thing because we're not always capturing all of that data. So some of the successes and challenges, and I think you'll find this really interesting, just anecdotally. I mentioned that we're better able to coordinate existing services to be a little bit more efficient and effective with the limited resources that we have. One of the biggest things is just new information. The information sharing has just been really just so remarkable, because we often get caught kind of in our silos of what we're actually trying to do, and we miss the big picture. So one of the examples I really like to, is a good success story, is we had a fellow who was aging out of care into adult services. And, you know, there's usually a drop off in services there. And all he needed was housing. He was a young guy, you know, and that was definitely one of his more prevalent risk factors. But for some reason, the housing providers in that community had labeled him violent. So he just couldn't access housing. And we have amazing probation officers at our table who are just, so they brought him forward to the table. And we have RCMP, we actually have we have a youth member, and we also have a mental health liaison officer that sits at the table. And you'll be interested to know, like, people bring their databases to the meeting. So, you know, the RCMP, they bring their MDTs and they're like punching into Prime. We have MCFD that bring their databases as well. So when we meet that privacy criteria through the acutely elevated risk, we share quite a bit of information. And so RCMP was able to bring up a file and say, like, bring up his file, and there was no history of violence, like none whatsoever, which, you know, and then of course he was labeled violent. So the service providers at the table were like, okay, well, let's give this guy a chance. They offered him the support services, a housing provider, you know, took him in, and he's been successfully housed for the last year. So that was just like some information sharing around that. Sometimes a service provider might think that a person's doing well, like you talked about, you know, maybe they're connected to services. We have a Discovery from Island Health. It's a youth and family substance program through Island Health at our table, who reported back about a referral about a young person and said, you know, this person's doing great. They have a job, you know, they're doing really well. They seem to be connecting to family. And then again, our RCMP counterpart was like, they had 35 missing persons call last week. So you get a better picture of what's actually happening in that. So it's really, really, really been very, very valuable to get a full picture and make sure that we're offering the services that they need. The other thing that's been really successful about the table, and I don't know if this would be a challenge here, it is in Nanaimo, is just being hard to find and hard to locate people, especially transient people. And so we have a community safety officer program in the city of Nanaimo. So that's kind of our bylaw kind of counterparts in between bylaw and police, and they work quite closely with our homeless population. And they are out there all the time, so they help locate folks. We had MCFD who was trying to track down a parent whose child was going to go up for permanent adoption, and they couldn't find that person to inform them. So we know that like that's huge. And so the CSOs were able to locate them. We have many youth referrals that come to the table of transient youth, hard to track down, hard to connect to services. Actually, in one particular meeting, when we were having a discussion, our mental health liaison officer said, this youth is in cells right now, let's go. And a group of them went right up to cells to try to get that youth connected to services. So those are some of the examples of that too. I mentioned earlier that there is a community of practice that's built, and I'm sure you guys already built that, you know, through various other ways. But we definitely share tips and tricks of like just the client-based service care and how to connect them to other programs. And it becomes almost like a moral support. And I'm going to talk a little bit about how I got the table up, but that relationship building is going to be really important because you're offering services and, you know, and you're going out together. So take time for that relationship building, get to know each other in that way as well. The other thing I think has been successful too is just the amount of agencies that we have at the table here, like in Nanaimo. I think Ali, you said you have an average of 18. You know, we have above that, and we definitely get some good referrals to the table. Not as much as Smithers, but they have like the super rock star there, who's an RCMP member and a social worker. So she just is able to bring all of that stuff. We definitely worked really hard to get RCMP referrals. I don't know how many members you have here, but in Nanaimo, we have over 150. So how do we get referrals from RCMP? Because as Ali mentioned, we're trying to take those cases. We're trying to intervene before they even need police services. And so it was a real challenge. So my co-chair and I actually worked with the local Nanaimo RCMP to build a bit of an internal referral process. So we had our LAN guys build a RCMP email address with a really simple email that members could email to our reps at the situation table with kind of file number, you know, what the risk factors were, and then that person could bring that to the table. And as soon as we did that, we definitely got a big increase in referrals, and we get referrals for missing persons. So we have a missing persons unit. We get all of their referrals if the members there are having a hard time tracking them down. Referrals for youth, which I think is a great avenue to, you know, because you got to remember that the table, as Ali mentioned, is an intervention table, and it's very broad. So it's meant to prevent victimization. It's meant to prevent criminal offending. It's meant to prevent, you know, a mental health crisis or eviction. So that's kind of the focus of that. So getting the RCMP referrals were really important, and definitely a success in it. And it looks like you've got great support with your RCMP partners here as well. So that's really key. And without RCMP at the table, you'll be missing a whole big piece of the picture. I know when our members can't get to the table, we have gaps, and when we're trying to figure out what's really happening for individuals. So some of the challenges and barriers that we faced is, and you'll face this as you kind of get up. I think when we first started, we had such a hard time getting referrals. And I remember sitting there saying, are you telling me that there's nobody living with risk in the city of Nanaimo? And of course, everybody laughed, right? Exactly what happened. Our first referral, we had somebody from Victim Services make a referral. And of course, our health partners who work with the most stringent privacy, which they should, but they, are definitely the ones that are always kind of our second thought around how we share information and making sure that we're following our legislation and being really careful. And so this referral came forward. We decided, as most of us, that maybe it didn't fit the AER criteria that Ali was talking about, although I thought it did. But so this is some of the challenges. You're going to come together and you're going to figure out that some people are going to have a higher threshold. I think anything's a risk, but I work from a macro level. I don't do frontline. Our RCMP member was like, oh, this is low risk because they see a lot, right? Or MCFD. So in this particular case, we determined that it didn't meet AER. And then after a couple of meetings, we were like, wait a minute, maybe that person did meet AER, as we kind of learned. And it was too late. They had been arrested already. So it was kind of like a really good learning lesson. And so I think, if you're not sure, bring the referrals forward anyways, because you're going to decide together. Yeah, go ahead.
So,
well, you're looking, yeah.
Designed on super high risk people. But ideally, you would look for medium risk people that you can prevent from becoming high risk.
Well, yes and no. If you look at Ali's slide, you have the AER up here, right? This one right here. So probability of harm occurring, right? So that's they could have other risks, but it's this criteria that you're looking for. So that, there's a significant community interest at stake. If you don't do anything, then that risk is there. It doesn't mean that it's actually happened, but the risk is there. So it's a little bit of a gray area that way. And then of course the intensity, like you're talking about, major impact on that person's life, risk of death or any of those types of things, and that it requires more than one agency to lower that risk. The other thing too, and Ali mentioned a little bit, is that if they give you consent, because this is what we learned also at the very beginning. We had one referral come forward, lots of risk, but maybe not meeting this exact criteria, but said, please take my case to the table. I need help. And of course, we being new, we're like, oh no, they don't meet the risk. So we denied them. How sad is that? Thinking about that now, like, these people, but, talking with the province and kind of working with learning from other situation tables. If they have more than one risk, like a multidisciplinary risks, and they've given you consent, then you can definitely have that discussion at the table. So that's something to know. So you're kind of looking in between that intervention piece, right? So it's what I call more of a midstream. If you look at community safety and well-being, you have your upstream approaches, which is really working with children and families and parks and recreation and all of that stuff. Your midstream is targeted to people who are already living at risk, so they don't need those downstream responses like police or emergency services. So it's kind of in between. Mm-hmm.
What do you do in case where somebody meets the AER requirements, but they're kind of in denial that they're at risk, although others are saying, like, how do you keep them in your system? Do you kind of break them off?
I think that's going to come down to the individual community and the folks. And I just give examples because we have an alarming trend of young females being referred to our table. Substance use affected, definitely living at risk amongst the street population. And all this is about offering support services. We don't force anybody. We can have that discussion at the table because they've met this without their consent, but all we can do is go out and offer that. And I think each community does it a little bit differently. And I think traditionally, you know, we're all tapped out. I know a lot of service providers, you know, have really big caseloads. But what we've done in some circumstances is that we go out to offer support services. If the youth is just not interested at that time, we keep that discussion open and we get them to keep going back until hopefully one day their relations have been established or they've been connected to services. But sometimes you will get folks that will deny those services. And there's not much you can do, but at least everybody in that room and all the service providers now know about this person and can try to make connections in different ways. So.
Perhaps were acutely ill that required further intervention. Going through the police, where the situation table or the folks on now thought, no, let's go deal with this. And then that person came to harm because they didn't get the acute care treatment that they needed, or
Yeah, we haven't had a particular instance like that. Oh, sorry.
Just wondering about if there is any risk to someone not receiving the level of care they need because you've got all these frontline staff that are consummate professionals and can go and deal with the situation. If they're working with that client person and think, well, we can deal with this. They don't need to go to jail. They don't need to go to hospital, but then they end up going to harming themselves or committing suicide or something.
Yeah, I mean, we've been successful in the sense of at least connecting and if they don't want, you still have to follow your own protocols and your own policies, right? So if you know, just like if you're, you know, we all know if a child's at risk, there's no ifs and buts, we're gonna go to that. So you bring your agency's policies and rules with you. We're not a case management table. So when a referral is made and you're an agency that might be part of offering support services, you're going to keep your own case management notes. You're going to, you know, follow your own policies and procedures. So if for some reason there's a referral made that, say, police have made a referral and you know, as a service agency say, oh, no, we need to, you know, call 911 or we need to do, then you do that. You follow, like, you bring all your expertise and your knowledge and your organization's policies and rules and regulations with you to the table. Yeah. Yeah.
Have you ever tried to resolve the risk, but there's no service for that?
Yeah. Yes. All the time.
How do you deal with that?
Yeah, it's a struggle. It's, you know, like we desperately need more housing. We desperately need more mental health and addiction supports. Like we need, I'm sure, just like here as well. And so we've been innovative in how we offer those support services. And then what ends up happening is then you have a network of agencies that are providing support to that person. And as soon as something comes available, you know where to track them down. Everybody's on the lookout for that person. But yeah, we do definitely have people who need housing or need treatment and want treatment, but we just don't have anywhere to bring them to. And so we run into that all the time. So it's not about an increase in resources, but it's about how are we going to triage, basically. And then we do, I know this comes up in other communities, and maybe this will be a discussion that you guys have, is that people talk a lot about how maybe there's an inequitable, like you're talking about services. If somebody's in Nanaimo anyways, we've had people jump the line, quote unquote, jump the line to housing placement or to health placement because of their risk factors, because it is a triage table. And each community, I've heard from other chairs, they talk about this and how it works for them. But in Nanaimo, we've worked it based on kind of risk factors and the relationships that we've been able to form. You know, when you're doing your services, when people are ready to accept those services, even if they're, you know, maybe 10th down the line, but the first and second aren't ready to take services, then, you know, the table allows for that triaging. And so we try to do the best we have with those resources.
I think it's excellent. It's kind of, a lot of us in the community are doing this already. I'm the the community integration specialist here from the ministry.
Yeah.
And, but it's like cobbling plans together, you know, we all have, you know, the same client or whatever. We're always like, oh my God, okay, well, you can take this part, I'll take this part.
Yeah.
Through that way. So it's nice to see, this might be good that we have sort of one
Yeah.
central place to get all of that information.
Yeah. It's a formalized process. Yeah.
Look after these clients.
And you're protected by your legislation, by your integrated program agreement to be able to share that information. Ali didn't really talk about it, but one of the things that is going to be really important because you know, sometimes it's always the right person at the table from that right agency. And so one of the things that we did in Nanaimo when we first started at the table is we pulled together a systems leaders group. So that's your executive directors, your decision makers. And you get them, and we talked a little bit about this model, what it could mean for folks, because they're the ones that are going to commit their staff time. So you have to get buy-in from those folks. And what's been really nice is they are the ones that can advocate for the change. You know, so when you talk about resources and services that you can't connect people to, when they hear of the work and they see all the data, they now can either maybe within their own agency make some policy changes about how to work more collaboratively together or advocate. And so we pull that group together twice a year. And through that, we tell them what's happening with the table, the challenges that we're facing. If there's struggles with particular agencies and just maybe the policies or the way they work, we share that information to see how we might work better together. But we also try to hash some things up on a higher level. So we're getting a new remand center in Nanaimo, which will mean we'll have a lot of people released from correctional facilities within the city, but no supports and services to go with that. So the systems leaders table of the situation tables is having discussions about that and what that might mean on the front line and how we might be able to be a little bit more strategic about that service that's coming to the community. So, yeah. Some of the other challenges, I talked about the referrals, of course, the lack of capacity and resources. And so then I think it's just really about how do we be more efficient and effective with the resources we existing have, and how do we actually just do business differently, like think outside the box. Yeah.
What data are specifically lifelong conditions that impact executive functions such as brain injury and other diagnoses that are particular to executive function?
There's a whole bunch of risk tracking. So there is, so the province has come up with a bunch of risk tracking that has some of those elements when we talk about physical health. But as a community, if that's something that you're seeing, like for us, we wanted to track all our homeless population that actually was getting CLBC funding, right? We also know that with the crisis around the fentanyl, we're getting people with permanent brain damage, right? So, you know, so that's something that you could track through this risk tracking database. Yeah, for sure. And then the other thing, I have lack of sustained funding from the province, and Ali's team, just so you know, is awesome and great. But of course, that's that one-time funding that you get. We've been really blessed with our council to support the work of the situation table. So they've committed 10 years of staff time to the table. But it's time, right? It's resources, and there's more work up front to do the training and build the relationships, but there is ongoing work. And so we do, I think all of us say to Ali, we could use more money for staffing. And there are like really different ways of supporting that position as you guys talk about your chair. Like I know in Chilliwack, they get Reaching Home funding. So they actually take some of their Reaching Home funding 4 hours a week, and they pay a chair. So there's different ways that you can think about doing that. But of course, it would be nice for continued funding because, some of that stuff comes down. And but Ali's team is awesome as far as like trying to bring people to the table and providing that staff support has been really great. But we need more money. And it's a political thing, right? But, go ahead.
This might be a question for Ali, but I'll throw it out on the table. I feel like I have a robust understanding of how the participants are protected by the program agreement and legislation. I'm curious, since it's a non-consensual sharing of information, if there was an ethics review of this model prior to launch.
Yes, so the agreement, when it was initially being developed, the template, the privacy commissioner reviewed it. Essentially, the agreement can't be developed, it can't be signed by public agencies until the privacy commissioner has addressed all the concerns. So that's up to the privacy commissioner's team, and they have essentially said, we have reviewed your process, we have done, essentially looked at the agreement, looked at the participation, the information sharing, data storage, and it's compliant with FOIPA.
Yeah.
And that's essentially the requirement we have under the legislation.
Okay, but they're two different things, right? FOIPA and ethics are, okay. And then my other question is this typically a city initiative? So like the city applies for the grant and then it's brought to community agencies to garner the people at the table? That's
Really good question. Yes, so it's a municipal-led initiative, so the province provides a one-time funding support, but it is, we provide best practices, connection to services, but we don't really dictate who sits on your table, how you operate. That is up to the municipality and the partners.
Okay, thank you.
Yeah, and each community is different. Like I know North Couch and Duncan, they have RCMP. Like actually, when I talk about chairs, not just leading that piece, but then they'll have a reaching home coordinator who will chair the meetings. You know, lots of crossover too with coordinated access or like a BC housing placement table and the work of the situation table too. And so you just have to figure out what works kind of locally as well. I see Lisa coming up to the front, so I'm just gonna wrap this up, and then I just a few, and I've left my business cards here, so if you want to connect, building that community of practice is really important. I know Ali talked about the monthly, but just in Nanaimo, I think we know that there's the work that we do can be traumatic. And we have a history of trauma and, through all the different agencies, even when we're looking at our history of colonization, there's trust and relationship building, I have to say, are the things that you have to focus. It won't work unless we're all at the table together. From all avenues, from, enforcement to mental health to MCFD to all the ministries, like we all have to come together to do that. And so you have to take the time to build the trust in the relationship to be able to do that. We did a lot of training together, and that allowed us to get to know each other. We actually do social gatherings a few times a year just because the work is hard. And so just to get to know each other as people was really important for us locally as well. And I think too, and Ali could probably talk about this too, is like, don't worry if you don't have all of these people at the table. Build the plane while you're flying it, because what ended up for us is we started out smaller, and then I actually had to hold back agencies from coming to the table because we share confidential information. So you only want the right people at the table. We have a lot of table supporters who we can kind of have secondary supports. But we actually have a terms of reference where you understand what your role is, and you have to be able to attend the meetings, and you have to be able to do client-based services. You don't want people who maybe don't do that kind of work, but maybe are in the nonprofit or social sector at that table. They can be table supporters in different ways. And so you'll have to figure out how that works, but just move on it, because the more you say, oh, we need this person, we need that person, it stalls it and it kind of loses some of that momentum. So I think it's really important to do that too as well. And I think you just learn together, because I know every community is different. We all function a little bit differently, and you're going to create something on your own. Go ahead. Yeah, so I mean, Ali can probably provide some examples, but I know for us, we have a little bit of a page. So I actually get referrals. I've gotten referrals through our council who've been talking about it, and they'll refer. I've gotten a referral from a parent directly to my website, but we do have partner referrals. And what I say is I just get them connected to whoever's sitting at the table, and then they can kind of make that referral process. You'll learn through the training that there's an internal filter process to make sure that you're you've exhausted all avenues first of how to connect that person to services. But if you're a library, we do have library referrals, but we connect them to the service agencies that are at the table. That's not sitting at the table just because of that function. Yeah. Yeah. Any other questions?
How quickly did you get up and running?
So we started our training, I think, in September of 2022. And so we got our first meeting up at the end of January 31st. So yeah. And I'm sure other communities have done it faster or slower.
I think the average is 3 to 6 months, because there's this training, the 3 modules of training that you have to get everybody together, so it's scheduling issues. But once the training is complete, you just start meeting next week. So it's the training spread out over a few months and then you meet.
Yeah, and then the systems leaders group, you probably, because you want to talk to those decision makers because they're the ones that are going to commit staff to the table. And so you want to take the time to do that as well. Yeah.
So I'm interested in the Smithers model, who's chairing that, because in our community, we're unlikely to have any one organization with the staff time to tackle it all on their own. I'm kind of thinking, well, is there a model where people do contribution agreements, like from places where they have a bit, and they have a bit, and then provide it to the chairing organization to provide that sustainable model?
So very good question, and I'll start by saying, so the participants here, most of the, like if I go through our 36 active tables, one of the organizations here probably leading a table somewhere. Like we have in First Nation community in Terrace leading the table, nonprofit, a friendship center, we have RCMP, we have health authorities.
What is Smithers is?
So it's an RCMP officer who is also a registered social worker. They have a unique perspective. And they are the ones leading there. So historically, when this tables were first brought in BC, it was brought actually by Surrey RCMP. They brought this model, set up a set of 2 tables in Surrey BC. 2 years into operations, the municipality was like, hey, this is an important initiative, and perhaps RCMP is not best suited to lead it, just based on perception. So they had municipal staff come over and take the model. We have mental health liaisons in detachments, RCMP officers that sometimes are involved in sort of getting the table up and running. Nonprofits, nonprofit representatives, people like Foundry, Health Society, those folks working, they are involved in generally in, for example, I'll give you 2 examples of sort of contribution agreements. So Coquitlam in New West and Vancouver all received funding for the Building Safer Communities Fund. So from the federal government. So they are leveraging that funding to say, hey, we'll support the table over 5 years. So it's, it's the flexibility the model has. You can leverage other funding to support the initiative. The provincial support, so the grant that we did provide for this, can be so it's leveraged for the training. I think just under half goes towards training. The rest can be used by the municipality and stretched over years to support the model, whether it's to booking meeting rooms, getting coffee and snacks supports that are coming to a meeting, or paying for some in-kind contribution. But again, as Christy mentioned, the way we operate is a one-time funding grant. That isn't to say that we don't provide support in the future if there's a huge turnover. So imagine all the partners that train on the table leave the community and you have new participants. We'll provide a supplemental training grant. So we'll make sure that you are trained on the model, and the province will work with you throughout the process. So that sort of support continues. But the reason we structure this as a one-time grant is based on the Canadian model is the in-kind contribution from agencies. So over the long term, we have seen the caseloads go down due to the effectiveness of that collaboration and the efficiency in service delivery. So over the long term, we do feel that the model is sustainable.
How often and how long do you meet for?
So we meet every 2 weeks. So other communities meet weekly, but we meet every 2 weeks. We're a smaller community. And we usually meet for about an hour to an hour and a half, but it just depends. Like sometimes we're there for 45 minutes. Sometimes we're there for an hour and a half. Depends on how many referrals we get, or if there's any other kind of alarming trends or things that we might want to have a discussion about. The process for our meeting is that we usually do a round of introductions every time, and then we always appoint an agency at each meeting to spend 5 minutes just to talk about what they, and it's funny because you think you know everything that's happening in your, and then, you know, we go through this and we rotate every single meeting and you learn a lot more. And then what we always have a little bit of time at the end, and you'll learn this from the training, is that when a referral happens and you've got your agencies appointed, you actually, we have the room available for those agencies who are going to be part of offering that support services to do a huddle right away and to talk about how they're going to connect with that person, who best has a relationship with that person. Do they all go together, or do one of them go together to get them connected to those services? So, yeah.
The one thing I thought I'd build on is when Rod and I were submitting the funding application, we put a timeline, which we thought was reasonable, of having a table up and running by November. Faster, great, but we acknowledged that we were hitting things with the summer. So I think one of the key things I'd like help with Ali and Christy with is the next part of our agenda. And we know not everybody was able to make it today. And I know that there may be people who should be in the room aren't in the room. But right now, it would be good with those of you who sat and participated to see, is there any interest or curiosity? And some of you may be decision makers in your organization. I actually see some of the potential executive sitting here. And you don't have to answer now, but anybody interested in taking a lead? Let's start with the easier one. Who's interested in potentially being a partner to sit at the table and contribute staff? Or requesting up that be considered? Okay. And I also want to acknowledge that we have our fire chief and our bylaws here, because it add our director of Parks, Recreation, Culture, and our planning manager, Daniela, as well as the RCMP. So there's a lot of municipal support, as well as Councillor Southcott, who is remote, Councillor Elliott, Councillor Dowd, Councillor Isaacson. So you can see there's a lot of community interest and support in this. And so one of the things I want to make sure is that coming out of this, we have a next steps and a process. And I might ask Christy, when you think back to when we were starting this in Nanaimo and trying to get the community on board, what would be a good next step and messaging back to all these organizations who are here? There are a few who couldn't make it, who will get this. We're recording this, but by the way, you're not being recorded, but we're being recorded, so that we can share this information with others. So
Yeah. I think how I started really kind of like a session like this, you know, just, you know, bringing the idea forth. I think we did have Ali come and present too as well. And then right away, I held a meeting with the what we call the systems leaders group. Different communities call it differently, just to make sure that there was that commitment, because we do talk about that commitment. If you have gaps around the table, you feel it. Like I think I mentioned earlier, like when our RCMP members aren't able to attend, there's a big gap, or our MCFD, you know, people aren't able to attend, there's a gap. So it does require commitment. And so you definitely need to have buy-in from your leadership to be able to commit to that. And I think that they can see the results. Like if, you know, we share this presentation with them and they are able to talk to other communities, it's been really effective. And so that was the first step I think I did. We did the training together. An established table, when you get new members, they kind of do training individually. But because we were starting, this was actually just like you guys starting big. It was a blessing because we got to ask questions side by side. We got to do the training. So we got to know each other over time. We shared meals together. And then you'll do like some mock situation tables. So then you can kind of really get into some real tabletop training around the situation table. And that was really successful. And then it allowed us to really see who the key players were. You don't even need to have, like, it's nice to have the chair, but you know, I didn't have a co-chair at that time.
That's why I thought I'd start off with the easier question.
Yeah,
because
exactly.
once the partners at the table and learn more, then you start saying, oh, it makes sense for me to say yes, and I have the support of.
Maybe when the city received a grant funding.
Yes.
So like, what does that look like in terms of distribution to partners or to the lead agency?
Right.
Because I feel like there may be people who have questions
Yeah.
to be answered before they put their.
Okay, so first of all, I'll say thank you, because the seed funding was increased substantially. What did we get initially?
We got 30,000.
We got 72. Okay.
Yeah.
So thank you. That was really helpful because again, whoever takes on the chair, it is taking away from your day to day, even if it may result in a reduction of caseloads for your organization or whoever chooses. We have to see, so the 72,000 and what I'm hoping is getting the buy-in of the executive, some of whom I'm looking at in various positions who have influence in their organizations where they could go back to a board or a committee and say, hey, I think we need to dedicate some staffing resources. And one thing I was thinking, because it's a bit different than the Nanaimo model, is that 72,000 does include accounting for training. However, there's options to reduce the amount for training in terms of other options. Like there's the training model with the people out east, but Christy, you've got some options where there's training that might be less intensive but free of charge. So again, taking less of that 72,000 that the coordinating organization would use, which means that a good portion can be used for administration or the cost of a chair. So what I was thinking would be fair is there might be just only one agency that everybody says, yep, that makes sense. You lead, you chair, or it might be something where there's several and we do an expression of interest, make it as low barrier as possible to put together how that could work. If there's many agencies that are going, we all want to do it. Councillor Elliott.
So it's a one-time only, and I see the need for the chair to continue beyond the
Mhm.
initial startup.
Yeah.
And so, would we want to use some of that to coordinate a conversation around how do we fund the long term?
Mhm.
Given that in our small community, we're not likely to have one organization that can just fund that into the future.
Yeah.
And so I think we need to organize, get our membership, get on with the training, and we need to explore the idea of, okay, who could be a chair that's maybe not the main agency so that
Mhm.
facilitates better and
Mhm.
is well situated to do that, but possibly could be a nonprofit or whatever
Mhm.
that does not have the capacity to wear it, but could be contributed to through our model. And I think relying on the one-time front-end
Yeah.
grant is not the best sustainable solution. So I worry about using some of that to organize us for a sustainable solution. So that's my thoughts on that.
So one thought I had around that, and that sustainability piece is that whoever's picked as the lead has to facilitate what's the long-term plan. Because 72,000 could take us through admin, because it's not a full-time thing for maybe up to 2 years, potentially. You do also have the ability to rotate chairs where everybody says, you know what, year one, it is organization A. Year two, the one challenge with that is, again, there's a magic piece. And again, I think Ali's pointed this out, but Christy was absolutely the right person. And if she'd been sitting with a nonprofit, she just happened that we'd recruited her at the City of Nanaimo, she would have been the right person no matter the organization. So there's the magic of, yes, the right organization, but the individual who will have the respect, be inclusive for everybody, won't have, I guess the word is partisan, going, well, you're not at the table because your organization is difficult and I don't want to work with you. Be like, no, 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 we're all part of the solution. We all have resources that matter. So I don't have the answer for that. You all do, right? It's actually nice that in 7 months, there's actually, I probably know about half the room I realized, which is neat. And so there may be an individual and an organization. We don't know the answer to that yet. So we're just exploring, right? And I think the important thing is we didn't want to come in here, Rod and I and Ali and Christy, with this is the model of Powell River. It's not necessarily this business model. It's not the Nanaimo model. It's not Ali's favorite model. Well, this will be Ali's favorite model, right? What they don't know is that all ferries are canceled and there's a no sail list for these two. So they have to stay here till November until we're set up. They think I'm joking. Yeah. Oh, and the airport seriously is down. I think it's seriously down, right? So we're having the conversation early because you may have ideas, and maybe you're all quite shy, but you're all going to email and have your hands up and say, well, we didn't want to say it, but or so what we're hoping is we have all your names in a sign up sheet, and what we can do is schedule another meeting. We may not have Ali and Christy with us, but Rod and I can coordinate another meeting where those of you who are either would be part of that executive team, right? Not the actual people sitting at the table, or those who are need to reach back up to seniors can come forward and say, we think we're partners. Lisa.
I'm just curious for the, I'm not connected to any,
Mhm.
but for those in the room who might need to bring this up the chain, like what might they need from you folks in terms of support? I'm sure there's questions like that.
I think it's sharing the information that you've received today. So the PowerPoints, the live stream recording, the notes that Caitlin's frantically taking over here. Thank you, Caitlin. And then seeing if they want to engage in another meeting with us, having heard and seen, yes, this is relevant to us, or no, it's not, or actually I'm more of a person who'll be making a referral up versus sitting at the table or sitting at the executive. So what we can do is create a meeting that says, okay, if you think that your agency has a role at the table as a partner, let's start off with that. Here's the next meeting, and maybe we could schedule that in about maybe 2 or 3 weeks. That gives everybody time to share the information that comes out of this today. So I think I realize I'm flying the plane with you, and that we don't quite have the wings. Rod, do you have any thoughts?
With our grants application,
Mhm.
we committed RCMP resources to get us up and running, so
Yeah.
we will always be there. As discussed, at this
Mhm.
point, I don't think that that's the agency to take the lead, but we have our 100% support, so
Mhm.
we're good anybody to do this.
Yeah.
I think in the future.
Okay, Jay.
I think, what we would need is a little more operational understanding of employees. What's the chair role, what the
Mhm.
time commitment?
Okay, we can put that, good idea. Yeah. Yeah.
Forward, those kinds of things, so we can determine.
Yeah.
I think will help us determine what agency might be, because it seems to make sense that it's not necessarily the most engaged agency or group. It may be somebody who's kind of a bit to the side but understands, the local.
That's right.
Services. I think that would help to be able to make a decision about whether you want to participate as a chair.
So that's it. That's a really good question, and that's exactly what we want to get to. So at this stage, no table across BC when we're having discussions have a chair or membership identified. So that doesn't happen. So the way traditionally the training works is the first module is bringing everybody together. Everybody who works for clients have a discussion about community safety well-being and how this model fits within it. At that stage, we essentially ask partners to decide, hey, are you interested? Does this work for you? That's the first step in decision. Once that's made, then we ask if you're interested, let's say we ask 7 to 8 agencies, identify a community mentor within your organization, somebody who could go through the training process. So the training model is essentially train the trainer. So we identify 6 to 7 people from a community that will receive training, intensive training on the situation table practices. These partners can then further train other community members on the situation table. And within those 6 to 7 mentors that we have identified that have received training is like, who would step up to be a chair? So we want to make sure that people understand, have a really good grasp of what it means. Because the chair has to be trained. Even if they're just guiding the discussion, we have to make sure that they have an understanding of the 4-filter process. So that's traditionally how it's worked. So this conversation, having a discussion, I think this is a perfect time to have this discussion, because now that you have it in the back of your mind, hey, this is a model that is being implemented in the community, potentially down the line, we will get involved in some capacity. So I think this is the perfect time. And then Christy can speak to some of our example of how it went down in Nanaimo.
It definitely takes obviously more time up front, right? Just the relationship building and kind of being involved in the training. But on average, it's roughly about 4 hours a week when you're looking at, some weeks it's less, some weeks it's more, but if you're averaging, overall, and that includes things like attending the meeting,
getting the emails out to, I mean, maybe that person doesn't want to do that. Maybe you just all show up, you've got a set time and you don't, but then we will often do a summary email about referrals and what agencies have been appointed. So it's kind of like, that administration support behind that. And then of course you're at the meeting, chairing the meeting, but as a chair, you're like, again, you're not case managing. So you leave. And so anybody else who is at the table, who's been appointed to a discussion, it's within your own case management. Like it would be just like you taking a referral from the community but yet you have partners to work with. Yeah, go ahead.
Before I get to Kim, I was thinking one thing I could do with your help is saying for communities who meet every 2 weeks, here's the time commitment. This is the number of hours for training up front, and give you a sense. Because I think what I'm seeing is there's capacity challenges. And so knowing what would you have to invest initially to do the training, and then what would be an ongoing maintenance of a partner versus a chair. And I think you could help me with the weekly versus the ones who meet bi-weekly, and even there might be tables that meet 3 weeks, depends on the community, and give you that breakdown. I think that would be helpful. Kim?
That would be really helpful.
Yeah.
My question was about city capacity. So is there a
Mhm.
capacity of the city to allocate human resources like Nanaimo has to chair or to do the data collection?
Well, that's one of the reasons why we've come here. Okay, because we do have limited staff capacity. I mean, the fact that perhaps it was myself late one night putting in a grant application and getting Rod to help, it's not typical that you'd have the CEO doing that.
Yeah.
So bandwidth is, and one of the things is, but council can direct otherwise. We do know that we have a unique position in terms of things like housing. So there are many people who have social service backgrounds in the community. Where we're unique is that we have the ability to advance partnerships with BC Housing, get housing on the ground, and some of those things that help mitigate a risk factor. So if we were to put time into this, and Nanaimo, my former city is way more affluent than we are. 15,000, 100,000, very different tax base. We are a community that I've come to in a very different stage of your evolution with the mill and things like that. However, council can direct differently. They're all sitting here. But we want to see what opportunities and capacity do we have in the community, and also where does it make sense? I mean, do you really want me as the chair every meeting? Maybe not, right? Right? Of course, that. Council Isaac.
So maybe an awkward conversation and something that's just not being spoken in the room. The city has historically funded a social planner position, and people might be wondering what's up with that. And why that role.
Okay, so one of the things, and it hasn't come back yet, and I don't want to stretch our planning department, but council has set some priorities around housing. And a social planner that's doing the work, aka a social worker, which is what a lot of you are involved in social services. We don't directly provide social services. We're more the upstream. So Parks, Rec and Culture, upstream, right? Hopefully we are helping prevent and engage, that type of thing. Bylaws, fire, police, definitely more responsive. So, and here we are on a midstream piece. Now, council can direct otherwise, but the 72,000 is an opportunity for us to see, is there a collaborating table already with a chair that's built a lot of that social capital already that has a role? I don't know. I don't know the answer to that. And maybe you do. So I think, sleep on this. I'll give you 2 nights or 7 cups of tea, whichever works. And also a chance for our council to reflect now that they've heard from Ali and Christy on the experience of Nanaimo, because this is new for us, right? And our community here is very unique. And it's very unique because I think we justify big city resources despite being only just under 15,000, right? And so leveraging it, our council is advocating for that. But at the same time, we have to be mindful of everybody's capacity and the hopes that once this works well, that it actually increases everybody's capacity. And the outcome is better for our individual community members who are struggling. So I realize that we are close to time and people are looking like they need to leave. So next steps, I think we have a commitment to get information from this back out to you, get some clarity on roles and what it would look like in terms of how many hours of training it would take for everybody, partner, chair, regardless. and what that would look like weekly, bi-weekly, every 3 weeks on an ongoing basis in terms of commitment. And it's a chance for you to connect back up and see what makes sense. And also to spread the word to those who maybe didn't make it today, either because I didn't know who they were or they weren't forwarded on, or they just couldn't make it. And there's a couple I know, like from Plahaman, who couldn't make it. So I'll be meeting with them and talking with them around that piece. 'Cause I know a lady called Verna Francis was quite interested in participating. So I'm going to close off. Christy will be available. Ali's got a meeting at 2:30, but they'll both be here for the next half hour. But I just want to allow for people to leave because we can respect people's time. So I'd like to say, I actually am almost a bit emotional. I really miss Christy. We worked very closely together in Nanaimo. Thank you for making the time to drive up here. Ali, I'd only met you virtually because this all started during COVID. So really nice for you to come and make the effort to come to our community. We hope you'll come lots. Or you may just be staying here as I've canceled the ferries. I'd also like to thank Callie Matthews and Caitlin for their help with food. And also just a big thanks to our council and of course Rod Wiebe for actually helping bring us together today. So those of you who have questions, please take the time while we have Ali and Christy here. And for the rest of you who have to get on with your day, we will be in touch again. So thank you.
Thank you.
No.